Dr. Kothari, thank you for joining us. We'd like you to share your views on role of AI when it comes to critical care patient monitoring and how this is going to be helping scale up in a country such as India.
Thank you. So I think the problem really lies with we are having quite a bit of nurse attrition. You see, I worked in the public sector, I worked in the private sector, I worked abroad also. And what I find is that in our country we need to elevate the position of nursing so that the kind of attrition that we are facing, right now is somewhat mitigated. And what happens is that, when we train nurses, they go away, we get new nurses, they do not pick up things when they're going wrong with the patient. And that obviously gives rise to complications that could have been possibly averted. So AI, I think, is very important here because it gives an additional tool where the data would be processed by, whatever computer algorithms that would flash up a warning to the nurse that something is going amiss. So if the nurse has not picked it up or has not had enough training to be able to understand what is happening to the patient, what is going wrong with the physiology of the patient, the AI-driven algorithms would definitely help in early recognition of the deterioration in the patient's physiologic status. And that would help us in averting possible catastrophic problems that can occur in patients who already have multi-system issues, who have multi-organ dysfunction.
So, how do you think AI has taken over, particularly after Corona, when it comes to critical care, and patient monitoring?
So I think during Corona we understood that in order to avoid unnecessary physical contact with the patients who were infectious, the use of the video rounds became quite popular, where we would have one of the junior doctors going in with a full attire and then getting us to see the patient through the video round, and that really helped in understanding what is happening to the patient, at the same time in facilitating the care of the patient. So I think that COVID has given an impetus to the use of technology in order to monitor patients, also in order to be able to interact with the patients at a distance. And I think this is going to be very important for India, because India, we have a lot of rural population. We have hospitals out there which may not be able to carry out the best possible practices, which may not have the most experienced doctors out there. So to be able to reach out to a doctor who is a senior doctor in a more infrastructure rich institution, and to be able to take the input from that doctor to be able to then apply to a patient in the rural area to try and at least understand the problems and try and bring about a rational treatment module for the same.
So what are the challenges when it comes to adoption of technology such as these, and particularly in strict systems and tougher systems such as critical care? Because within ICU there is always a rush, there is always an emergency. How do we deal with those situations while implementing technologies?
So I think what is important is to understand the place of technology, because nothing can really take the place of an adequately trained doctor or a nurse. Okay, so that is most important. And I think the physical aspects of examining the patient, also taking an appropriate history, is, it's something which is invaluable. But to add to that, the technology obviously adds a boost out here in terms of monitoring the patient's vital signs, because in some ways one cannot measure cardiac output just by looking at the patient or feeling the pulse, or by looking at the patient, understanding what is the oxygen saturation, or if the patient is having an abnormal state of mentation, what is happening to the patient's electrical activity in the brain, which you can catch up through an EEG. So obviously technology is very important, but I think it has to be a part of an entire composite way to monitor and treat the patient, starting with the nurse, the doctor, and of course the technology.